In 1961, Fannie Lou Hamer went to the hospital for the removal of a small uterine tumor. While under anesthesia, she was given a hysterectomy without her knowledge or consent. Welcome to episode 1 of Hidden Medical History, a series where we'll uncover the individual stories, court cases, and moments that led to changes in the medical industry. Be sure to follow and share. Today, we'll talk about Fannie Lou Hamer and the Mississippi Appendectomy. Between the 1920s to 1980s, forced involuntary sterilization of poor black women was so widespread that it was called the Mississippi Appendectomy. Many women would go to the hospital for lower abdominal pain and would instead experience forced sterilization. Teaching hospitals would perform unnecessary hysterectomies on poor black women just for practice for medical students. Hamer's experience prompted her to join the civil rights movement. She found that 60% of the black women in Sunflower County, Mississippi experienced the same malfeasance she did when giving birth. And her testimony before the Credentials Committee at the 1964 Democratic National Convention brought national attention to the issue of the Mississippi Appendectomy. Her testimony was so powerful that President Lyndon B. Johnson called an impromptu press conference to try and get her off the air. Formation of Medicaid in the 1960s actually allowed for many institutions to benefit financially from Mississippi appendectomies. Today, Medicaid reform, informed consent, and patient care are at the forefront of medical care in the United States. But we have to reckon with our legacy to prevent more tragedy. See you on the next episode.